Making with the Brain Worksheet. So that's what our conversation is going to be about today. So I have a question for you, and I want you to think about it. And for those of you who want to share what you're thinking, you can use the question box there to actually as a chat, and then we can read your comments, or you could raise your hand. But what I'd like you to think about is if in your workplace, with the people you serve, or even in your daily life, if informed decisions were made more often, these things would be different. What kind of things could you imagine might be different if people were able to make more informed decisions? So I'll just give you a moment there to think about that, and if you would like to raise your hand and share, or if you'd like to chat in something as a question that's really a comment, that would be very welcome. As we've been touring the province of British Columbia lately talking about informed decision making, some of the things that we've been hearing is that people would have greater knowledge of their options. I see a comment here about there would be better communication, better use of resources, people would be able to make more confident decisions and make those decisions sooner, that there would be a better use of resources and better outcomes. Folks are talking about, financial savings, confidence. Yeah, people would be able to reach decisions more consistent with their values. So thank you all for chatting in. People talking about satisfaction, so better experience of care and the positive communication. So we have this image that things could be better, that if people were able to make more informed decisions, that people would be more satisfied with their care, they would be able to have more realistic expectations of the benefits and potential harms of decisions they make. People have greater knowledge of options. Things might actually be more financially sustainable. It's really interesting that the research does hold that idea up. When people are more involved in decision making, they tend to make decisions that are less costly, which is a very interesting thing to think about. There's been a Cochrane Collaborative review in 2012 of shared or informed decision making, and they looked at 86 different randomized controlled trials of decision aids and really did support what you are all saying. So what we're going to do in this webinar is we have 3 topics to cover. The first one is we're going to talk very briefly about some kind of decisions, or definitions I mean, and then we're going to introduce, remind you about the spirit of motivational interviewing and how that applies to informed or shared decision making. And then we will also talk a little bit, focus mostly actually on the Brain Worksheet that we had the honor of developing with some colleagues and members of the public. So first, let's talk a little bit about some principles of person and family-centered care. And I think you'll see why in a minute. We're framing this as a way to really provide patient, if you want to say that, patient and family-centered care. And this is adapted from the Institute for Patient and Family-Centered Care, which is the nonprofit based in the United States that's been working in this realm for a very long time. And what they really have led us to understand is that the person or the patient is at the center, and they're surrounded by the family of their choosing, their self-defined circle of support. And that could be anyone that they consider family members. It could be a friend, it could be a neighbor, it could be someone in their faith community that's significant to their life. And they have, the IPFCC has described 4 principles for this kind of care. And the first one is respect and dignity. And when they're talking about respect and dignity, what they're talking about is that people who are in the position to help listen to and honor people and families, particularly their perspective and their choices. This means that knowledge, values, beliefs, and cultural backgrounds are incorporated into the planning and delivery of care. So that's respect and dignity. The second principle, which directly relates to what we're talking about today, as well as respect and dignity, is about information sharing. Helpers communicate and share complete and unbiased information with people and families in ways that are affirming and useful. People and families receive timely, complete, and accurate information in order to effectively participate in care and decision making. The next principle is about participation. And in this way, participation is thinking about at the individual level. So people and their families are encouraged and supported to participate in care and decision making at the level they choose. Some folks don't want to be as engaged in decision making. These are the kind of people that say, oh, you're the expert, you decide, or you tell me what you would do. If that's an informed choice, that's acceptable. But for people who want to be more involved, and we should encourage that, we want to give them that complete information and encourage their participation. The final principle is about collaboration. And when the IPFCC talks about collaboration, they mean at the system level. So they're talking about people and families included on an institution-wide basis, so that leaders in organizations collaborate with people and families in policy and in program development, in implementation evaluation, so that facility design, professional education, and the delivery of care is influenced by the voice of the people who are using the services. So those are the 4 principles from IPFCC that really help set up the stage for thinking more about informed decision making. Now here's the definition of shared decision making. This is from Dr. Vic Montori. Some of you may be familiar with Dr. Montori's work. He's at the Mayo Clinic. He's a diabetologist. He's a diabetes specialist. And he's been the champion of an approach called minimally disruptive medicine. And that's really an interesting term. But what Dr. Montori means is that healthcare professionals, when they're working with people and families, need to be considering how to disrupt or interrupt the person's life to the less degree possible. So minimally disruptive medicine. So we create care together that causes the least amount of disturbance in a person's life. Now, what Dr. Montori has said is that shared decision-making is the process by which a patient and a clinician work together to identify the best course of action at this particular point in time. So there's some really interesting words that were chosen in that definition, and it's clearly a process. So it's something that's ongoing, and it's people working together, and it's the best course of action at this particular point in time. And many of you may be thinking, yes, I understand that these decisions you make, and then you may revisit them, and that that's a totally normal experience, that we may change our mind at some point in time with further thought, further information, or further things happening in our lives. So this is a definition that can be useful to us as we go forward. Now I'm going to draw an analogy here about what making an informed or shared decision might be like. So here's an image of an experience some of you may have had, and these are some home decorators. So this couple has decided to paint their room, and it looks like they're having a good time doing that. And I'm wondering if any of the rest of you have also had that experience where you decide a do-it-yourself project. You're going to paint or redecorate or renovate your home. And you can do it yourself, and decision-making is just like that. You can decide to get the information yourself and make the decision all on your own, and that's perfectly acceptable. Now, there's another option when you're doing home decorating. You could actually hire a professional. So you could seek out an expert. And this expert, if they're really good at what they do, they're going to find out more about you. They're going to find out more about your life and your lifestyle, the purposes of the room, what works for you and what doesn't. Because they could come up with some very different designs based on their understanding of your preferences. So let's say you told them you wanted to design a room that could be a great spare room, or maybe even a bedroom for a child, and it might look like this first picture, or it might end up looking like the second picture. If they don't know you, and you may get a very different result, including one that doesn't actually fit for you. So in thinking about shared decision-making, it's this kind of expertise. If we don't understand what people want and what matters to them, the result that we decide or suggest may not actually fit for them. So I'm going to ask you all to use the question box again as a chat, and I want you to think about these questions here. So I want you to imagine that you're in the aisle of a very large supermarket, and this grocery store has many, many choices of cereal. And so what I'd like you to do is to just type in that question box, what factors do you consider when you're purchasing cereal? This woman is contemplating a purchase. What do you all think about when you're buying cereal? So we'll see what folks are saying here. I have one vote here about fiber or sugar, so thinking about some nutritional things there. What chocolate? Somebody mentions, does it have chocolate in it? We can see some of the options definitely do. Somebody else is thinking about protein, gluten-free, so different ingredients. People thinking about, yeah, fiber and sugar. Cost is coming up, and whether or not there's a lot of fats in the cereal. So lots of different things. Health benefits people are mentioning. Oh, and then the packaging. What's the impact of the packaging on the environment? Is this something I can buy in bulk and package myself, or looking at all those boxes and there's plastic bags inside? So lots of different things that we've thought about, or factors that are important when we choose a cereal. So now I'm going to ask you, what are the values? What is it that you're actually valuing that has led to that factor or that thing really mattering to you when you make a choice? So for example, many of you were thinking about health as a value. So that's the kind of thing. Other people are talking about freshness, toys inside. People are mentioning that there might be a way that you might treat people with cereal, that it could be like a birthday treat, or so people are mentioning some other values, or budget. So a financial value, you think about what's the impact on the budget, thinking about your family and even family functioning. So enjoyment might be a value. Okay, great. Okay, now that you're warmed up thinking about decisions and factors and values, here's another decision. I'm going to ask you to imagine something harder to imagine. I want you to imagine that you have a chronic pain, and and I want you to imagine you have chronic pain that's the kind of pain that impacts your daily life. Every day you are hampered by this chronic pain, and you have found out that there's a kind of cereal, there's a kind of surgery that could reduce your pain. There's a 50% chance that it's going to relieve some or most of your pain. There's a 10% chance that would actually make your pain worse. And there's a 40% chance that there will be no change. So it's a 50-50 chance that this will help you or not help you, and even the slight chance that it might make it worse. What factors now are on your mind when you consider whether or not to have this surgery? What factors? So people are chatting in that there's risks or benefits that they would really want to know. What particular risks or benefits are on your mind when you think about whether or not you would have this surgery? What other things would you want to know? People are saying, what time would I have to take off from the surgery? How long would it take me to recover? Is this surgery covered under my medical plan, or would I have to pay for this privately? People are asking if there's other options. Have I tried all the options? What are the long-term impacts of this procedure? Do we know? Has it been around long enough? When could I return to work? What might be the risks of the surgery? How about the surgeon's experience? If I'm not able to work now, could I go back to work? What haven't I tried? Is there other things that might improve my health? What's the healing time like? How soon would I notice a difference? So lots of things you're thinking about. Now think again about those values. What are the values that underlie the factors that you're talking about? What values are there? We've been talking about healing time, so there's a value on health again. People have been talking about financial, considerations. Is this a covered procedure, or is this maybe experimental? People are talking about quality of life. How will this impact my life? My stage in life. Am I nearing the end of my life, or am I younger and have lots of years ahead of me? So lots of values that we're thinking about that would actually impact whether or not we would proceed with the surgery. Okay. So those are two activities that are really designed to help us think about what helps us make informed decisions. And one of the key things is really what matters to us as a human being. And none of the values that any of us shared were right or wrong. They just are. And so it's important to be able to understand how those values actually inform our decision making. So next thing I'd like to involve you in, and thanks so much for being willing to use that question box and let us know your ideas. I'd just like to be I'm curious from this group, what are some situations where informed decision making would be appropriate? What are some examples from your life or your experience that would be you could see informed decision making being the right thing to do? Somebody's talking about college decisions for kids. You know, what college should kids go to? People are thinking about end of life. What kind of decisions do I want to make to have quality of life at the end of my life? Business choices. You know, what's the right decision to make in this business? Financial planning, saving for the future, personal planning, health, personal care. Goals of therapy are coming up. Whether or not I should accept a new job. Here's another option, whether or not I should cochlear implant, an implant to help me hear, involves a surgery. Should I take a job or not? Buying a home, moving, what kind of vacation could I choose? So lots of places we can think of where informed decision making would be a good move. So now we're going to go on to that second thing, now that we've talked a little bit about definitions and framing this with some principles and thinking about values and appropriate situations. We're going to review the spirit of motivational interviewing. Now, I may refer to this as MI, so I don't mean myocardial infarction or some other abbreviation for MI. I'm going to talk about motivational interviewing. Now, motivational interviewing is a person-centered approach or a way to be with somebody to help them when they're thinking about things that affect them. So it's a way to draw forth people's own motivation for change. This spirit of motivational interviewing is written about by two authors. You'll see them at the bottom of the slide there, Bill Miller and Steve Rolnick. They're both psychologists. And back in the 80s, they started promoting this way of being with people who were contemplating change. And one of the things that they've found is really effective is to adopt a certain attitude or philosophy when you're working with somebody who's contemplating a change. And making a decision, it may lead to some kind of a change, or even deciding to make a decision is a kind of change in itself. So here are the four things that make up the spirit of motivational interviewing. The first one is compassion. Now, Miller and Rolnick define compassion in a certain way. And what we're going to understand about compassion is that compassion is caring for another person and taking action to actually make a change. So we're going to use that particular definition of compassion today while we're talking. So that's the first part of the spirit of motivational interviewing. The second part is acceptance. Now, acceptance has quite a few different aspects in motivational interviewing, but the part that we're going to really be considering today is about respecting people's autonomy. So acceptance could be defined as respecting another person and their right to change or not to change. So a person's autonomy to make decisions. The third part of the spirit of motivational interviewing is partnership, working together with another person and recognizing them as an equal. So when we were talking about the designer, so the designer, the home interior designer has some expertise, but the person they're designing for has expertise too. They know their family, they know their routines, they know what kind of spaces they like, what kind of colors they like, what they value in how they use their home or live in their home. So that's the kind of partnership we're talking about, bringing everybody's expertise to the table. The last part of the spirit of motivational interviewing is called evocation. Now that's an interesting word, not used in common speech, but what that means is bringing out another's ideas, their strengths, and knowledge about the situation themselves. This can include encouraging them to explore. So this is what that designer does when they're drawing out from you and asking you questions about how you live your life, what you want to use the room for, what kind of things make you happy. So that is what evocation or drawing forth would be all about. So this spirit of motivational interviewing can really be the foundation for that informed decision-making conversation. We want to be with people with compassion. We want to accept their autonomy, their right to make decisions or not. I mean, that's clearly every capable human being's right. We want to think about bringing everybody's expertise to the fore and drawing out the ideas and what really matters to the person who needs to make the decision or needs to decide not to make a decision. And so you can see that these words spell out the word CAPE. And a cape is a really interesting image. And it can be a very helpful image if you think about the way we use capes. Capes can be protective, so give us a safe space to consider. Capes can also be a sign of honor. They can also bring forth people's superpowers. So the cape is a nice image to think about this attitude we want to go forward into making decisions with. Okay, let's move on to our brain worksheet. And Sam's been involved in the development of this worksheet. So Sam's going to tell us a little bit more about how it came to be.
Thanks, Connie. So we found the acronym, one of our family members was going through sort of childbirth and that process, and they found this acronym. We're not sure exactly where it came from. We've tried for 2 years to locate the source of it, and we haven't really come up with it. So if anyone knows where it came from, please let us know. Right now, we're attributing it to the Childbirth Education Association, and they've allowed us to adapt it for wider use. As Connie mentioned, we worked with members of the Patient Voices Network here in BC. We also had input from a number of other people that just, saw this peripherally or were interested in it and gave us some feedback. It was an interesting process because we worked with about 12 people on a committee sort of consistently of patients, and most of them were members of the Patient Voices Network. And we worked on how to phrase the questions, how to work through the different pieces of the acronym. And it was a really interesting process because we found that even with such a small group, there was real differences in the way they thought about decisions. So for some of them, family and caregivers were incredibly important in the decision, and they wanted them to be mentioned in the brain worksheet. In other cases, the patients felt that put a lot of pressure on them to involve family members. They felt the decision was theirs, and so they wanted it to be clear that if they wanted to include family members, that was up to them, and they needed that to be respected. And so the worksheet had to work with that thought. Another thing, we were having a conversation yesterday, actually, about the N too. So there's some disagreement about, so we call it next steps. Other people say do nothing. And so some of our examples are, the alternative is you do nothing, or a next step might be doing nothing, waiting, seeing what happens, and maybe making a decision at a later date. But making that decision to do nothing is a decision in itself. And so there was interesting ways that people thought about it differently. Along the way, we also changed the language to refer to people and individuals instead of patients. We felt that was an important change. It took a long time, too. I think it's worth mentioning that, it took about a year for us from start to finish, just with scheduling meetings, having people's feedback, really long discussions about the ways that we consider the wording. And so my colleague, April, she says there's 3 properties that a project can have. It can be good, it can be fast, and it can be collaborative. But those 3 properties, but it can only be 2 properties at any given time. So this was a good project, and it was collaborative, but it definitely wasn't fast. It took close to 12 months. Someone said if you want to go fast, go alone. But if you want to go far, go together. And that's what we felt we gained from having the patients, helping us to design this project. So we really appreciate the support from the PVN and other folks who've given us input. So I'll pass it back to Connie to talk a little bit more about design. The actual design of the worksheet. I'll just share actually, if you go to the next slide, Connie. This is the start of the brain brochure. You can see there's 2 versions. This is a trifold that we printed. It's a bit of a flashier version that we show when we go places, and we're happy to share the proofs with anyone who might want to print it off after this. We also have a PDF version that's available for download on our website, and it's freely available all the time. It doesn't look quite as slick, but it serves the function and is easy to download and print in black and white, so anybody working in any situation anywhere can print it relatively easily and use it. Yeah, I'll pass it back to you, Connie, to talk a little bit more about the actual breakdown of the acronym.
Great. So if you have any questions for Sam, be sure to chat them in, and people are thanking PVN in the box. So thanks so much for doing that. Yeah. So Sam mentioned there's this acronym that we were introduced to, and it's a really simple one. It's BRAIN, and human beings can remember 5 things. So BRAIN's a good word to think about, and the BRAIN stands for benefits, risks, alternatives, intuition, and next steps. Now, if you look up brain decision making on the internet, you will find a lot of references to childbirth education. You'll also find it as brains or brainier. You'll find lots of different versions of people who have thought about this as a really helpful tool. So we're certainly, as Sam said, not the first people to think of this. We really, CCMI is a nonprofit. One of the things we like to do is try to think of really practical ways to help people partner together for improved health. So this seemed to be a really good place to spend our efforts. So that's the acronym BRAIN. And here's the simple worksheet that Sam referred to. So this you can download right off of the CCMI website. So we'll make sure you get that. That's www.centercmi.ca. So we can put that in the box there for everybody to see. But so this is a worksheet, something to work through when you're faced with a decision. And certainly you could work through it with somebody, but it's designed to be able to be used on your own. So I'm going to walk you through all the different parts of this worksheet right now. So you'll see, and we're going to use this surgery scenario just as an example while we talk through it. So at the top of the worksheet, there's 4 questions to really consider as you begin thinking about a decision. And some of you used examples from like school or job or home, so you can think about these questions make perfect sense in relation to those decisions as well. So the first thing is to really clearly describe what is the decision I need to make. So having a really clear definition of what is the decision. Is the decision to buy a home about a different location, or is it about a different home in the same community? So you might want to be specific about that. So for our surgical decision, it's whether or not to have that surgery. The second question is, how much time do I have to make this decision? Is this something urgent, like if you'd had an accident and needed to decide to have surgery? Is this something about, you have some time, it's an elective surgery, so you may have a couple of weeks. Are you on a waiting list and you have to decide within the next, couple of hours or lose your spot? So how much time do you have is an important thing to consider. The third is, who's involved in making the decision? Who would you like to be involved in making the decision? Thinking about your own examples. Who might be the right people to have involved in the decision? Or you have some trusted friends or colleagues or professionals, experts that you'd like to rely on, somebody who's done the same thing recently. The fourth question is, what are my values that affect the decision? Now, back a while ago, we had that activity we did with the serial or surgery to help us all understand how to uncover values. Uncovering values is really answering the question, what matters to me? What matters to me about this decision? What are the factors that are important for me to discover as I think about this decision? And then underlying that are the values. Sometimes it might be hard to name the values, but getting at the answers to that question is about what really matters around making this decision. Okay? So those are the questions to kind of set yourself up to using the BRAIN acronym. So this is what the worksheet looks like thinking about benefits, and you will see what Sam was talking about here, that for some people, how this might benefit me is the question to answer. So what are the possible or probable outcomes? And for some people, they might also want to think about how might this benefit my caregiver? So if applicable, that might be a consideration. So in this benefits part of the worksheet, you would write down all of the possible benefits you could think of. So for our surgical example, the benefits might be that there's the 50% chance that the pain would be lessened, or a 40% chance that it would just stay the same. So there's a 90% chance you would be better off, or the same. All right. Okay, so that would be the benefits. You can brainstorm your list here. This might be an opportunity to turn to some other people to get information about benefits. Here's the second section. This is the R. This is risks. So questions to ask yourself. How might this pose a risk to me? What are the possible or probable risks? And if there are experts out there, do they know how likely it is? For our surgical example, we actually had some statistics. So a 5 out of 10 chance for improvement, 1 out of 10 chance for it being worse, and a 4 out of 10 chance for it to be unchanged for a person like you undergoing the same surgery. Again, if it's applicable to your situation, you might want to consider what the risk is to your caregiver or other people in your circle. So let's move on to the A. The A stands for alternatives. What are my options for short-term and long-term? Are there alternative treatments? No treatment? Do I have other ideas? So many of you mentioned this when you were thinking about factors to consider in surgery. Have I really tried everything else? Are there non-surgical things I could try? How long have I been in this condition? So thinking about the alternatives and what you have or have not tried is another part of making an informed decision. I is intuition. And so this is, what do I feel and think about the options? This is where those values or what matters to you come to play. What does my gut or my heart or my head, however I think about it, what does my intuition tell me is the right thing to do? How does this fit for me as a human being? I think this is a lot about what Dr. Montori is talking about when he talks about minimally disruptive medicine. How can we make this fit for an individual? What do I know about myself that guides me to make a decision for myself? So I stands for intuition. N stands for next steps. So there could be lots of different things that are next steps, including, as Sam reminded us, doing nothing. You know, that's a perfectly valid decision to wait or just to say, no, I don't want to do anything, or that makes perfect sense. So you might decide you need to talk to other people, need time to think, need more information, like to wait, want a second opinion, you know. Yeah, so doing nothing is actually a choice. So what would the next steps be? So the next steps might actually lead to making some kind of a plan or even an action plan. So next steps could lead in another direction. The final part of the worksheet is the space on the bottom of the form that says, you know, this is my decision. So the decision might be, I'm going to do nothing, or the decision might be, I'm going to get more information, or I need a second opinion. So the final step there is to actually write down what the decision is. Right. So that's an overview of brain and using this brain tool or this brain worksheet. So let me just show you a little bit more about what that slide looks like. This is what the worksheet looks like. And it's a two-sided sheet. You can see there the questions are on the top and starts with the BRAIN on the last. And so that's the a kind of a worksheet that you could use to make a decision. So I'm curious about your thoughts, if people want to raise hands and talk a little bit about what they've heard about brain using benefits, risks, alternatives, intuition, and next steps as a way to guide more informed decision making. So feel free to raise your hand. I know that Troy and Sam are watching, or if you want to chat in questions or comments about using your brain for informed decisions. Some folks are commenting that it's very easy to use and clear. And some of you know, and I didn't really introduce myself properly, I'm a nurse practitioner, and as soon as I heard about the brain device to think about making an informed decision, I started using it in my practice, and I have found people have been very grateful to have a structured way to have a conversation. I've worked with people who are making decisions about, you know, chemotherapy, or about whether or not they want to accept help in their home, or if they want to move to a facility where they could get more assistance. And people really appreciate having a simple way to guide the conversation. Folks are saying this seems really helpful. Here is a question about where and how does this fit in using it with patients in practice. So I'll tell you a little bit about my experience. As a nurse practitioner, as a clinician, I'm often in the position to give people information or to work with people who are facing a decision. So during the course of the conversation, I might introduce people to and say something like, it sounds like there's a decision that you're going to be facing soon. There's a way I've learned to make decisions. Would you like to hear more about it? And then if they say yes, I actually have copies of this worksheet that I carry in my nursing bag. I do home visits, and I bring out the worksheet, and then we can have the conversation together. Or if they want to just use the worksheet and think about it on their own, I can then leave it with them to have the conversation. For some people, the next step may be that they're ready to do something, and then I can move into action planning if that's something they're ready to say, I want to do this, I want to make a decision, and then we can actually talk specifically about when, where, how they might want to make their decision. So I kind of use, for those of you who are familiar with these techniques, I introduce it using ask, tell, ask, and then I introduce them to the tool, and then often it leads to an action plan. Looking at the questions here, where on the website can you find this? So if you go to www.centercmi.ca, and you can go to the page that talks about Learn, and if you scroll down, you'll see there where it says Shared Decision Making, and maybe there's a way we can put that into the chat box. If you go down there a little ways, there says Shared Decision Making Tools. It says Informed Decision Making Brain, and there's a PDF you can download on that part of the website. So thanks for that question. And there's a question here about, is this as effective with or without using the worksheet? I've had the opportunity before we had the worksheet to just write it on a piece of paper, and people seem to be very grateful. There was a daughter I was working with who was going with her elderly parents to a medical appointment, and she actually wrote it on a notebook that she took with her to the appointment with the specialist, and then the next visit she reported back to me that it was helpful for her just to have that to help her ask questions of the specialist. So I think that it can be helpful in either way.
One thing that is also, interesting, people have talked about over time, it's served as a record. So I've worked with some folks who used it, and they found that, months after a decision was made, they'd kind of forgotten why that happened. When you have long-term chronic illness, you might take a step at some point and kind of forget why, although there were very good reasons at the time. And so in some cases, having the worksheet, while it's intended to be, in some ways it's intended to be used as a framework for thinking about a decision moving forward, and in some cases you wouldn't even need the worksheet. In other cases, it's quite nice to have it as a record because it defines what your options were and clarifies why you chose what you wanted, what you did choose, so that looking back, 6 months or a year later, it's a little bit more clear why that happened at that time.
That's a very good point. I know that one of our colleagues used this with somebody who was facing a very serious decision about a family member who'd had a very serious accident, and they asked for several copies because they knew they were going to be facing many decisions in the near future. So it's really good to think about that and to be able to look back after the crisis has passed to really understand what you talked about. All right. So let's just go over what we talked about. So, and then keep asking questions. Happy to have any conversation about this. So we talked a little bit about our definition of what shared decision making is all about. And then we talked about this whole spirit or attitude of motivational interviewing, which again is remembered by this image of the cape: compassion, acceptance, especially of autonomy, partnership, working together as equals, and evocation, or drawing forth people's ideas and what matters to them. And then we showed you this brain worksheet, which just stands for benefits, risks, alternatives, intuition, and next steps. So it's a simple way to think about making an informed decision. So I'll just invite you to think about, what are some opportunities you might have to be able to use this brain tool for decision making. Sounds like some of you might be facing decisions about career or home or school. So I think with just a little bit of alteration, you could think about using your brain for those decisions as well. I also wanted to just show you a little bit bigger picture about this, which might also answer the question a little bit about how to use it in clinical practice. This is a diagram that actually grew out of a lot of work, both in the United States and Canada, thinking about self-management support. So let's just talk about a couple things. So self-management is what people do. It's the decisions we make every day on how we want to live our life and how that impacts our health. And self-management support is what other people do to help us. And many people have kind of observed that for self-management support, you can step up care, just like you can step up care for anything else. Almost everyone understands that if you go to see a healthcare provider and your blood pressure is a little bit high, first thing you get is usually some advice to alter your lifestyle. So you might get advice to become more physically active or lose weight or maybe cut back on the salt in your diet. So that's the first step in treating a high blood pressure. If you do some of those things and your blood pressure is still high and you go back to see that healthcare provider again, the next thing that's most likely to happen is you'll get started on a medication. And so let's say you took that medication and it didn't really help your blood pressure, maybe just a little bit, but not enough. The next thing most likely to happen is that another medication would get added to your routine. So now you have lifestyle, a first medication, a second medication. So your care has been stepped up. So supporting people to live well with chronic conditions can also be viewed as step care. So in this particular diagram, you can see on one side of the circle is the person and their circle of support, and on the other side is the care team. And in the gray box around is the environment where people live, learn, work, and play. Having supportive family and friends, a healthy environment, for those of you who are familiar with the language, the social determinants of health, how poverty and education really impact our health. All of those things are things that can be altered to support people to be more effective self-managers. At the bottom step, this kind of greenish step at the bottom, you can see on the one side of the boxes things that the person might be thinking about, and you can see how the care team might actually be able to support people in those situations. So this is where providing care that fits people's culture, that feels safe to them and can be effective in many diverse different situations, where health literacy, or making sure we speak the same language and use plain language in understandable ways and easy navigation, and engagement, where we invite people, like this way, informed decision making is one kind of engagement, where we invite people to be more involved in their care. So informed decision making is part of this first step here on this step care model. The next step up, and some people managed really great just with care that is safe and fits their culture and that communicates to them in ways that understand and invites them to be involved. Some people need a little bit more help. So they might benefit from the next step up, that lighter green step, thinking about folks who might benefit from some help with goal setting and action planning and problem solving and learning to monitor and check on their plans. Some people, even a smaller step up, need a little bit more help. And that's where approaches like motivational interviewing or sometimes care coordination, care management activities, maybe group activities can also be helpful for folks in that area. And then the smallest box at the top is when folks really have complex situations and they might need more support from additional kinds of specialists in a wide range of areas, different therapists, counselors, healthcare providers. So this is a way to thinking about self-management support. And what we've been talking about today in our way of thinking is a basic level of support that everybody deserves, the opportunity to make informed decisions about their care. So I think we've come to about the end of the material that we wanted to present to you and let you know about. And so I would welcome any other questions or comments from any of you. And thank you so much for the time that you've given to let us tell you a little bit more about the brain worksheet. And we're just in the process of letting more and more people know about it, and we'd really love to have you share it with other people and give us feedback on what you're finding. As we always find when we release things like this into the world, we learn so much, and we're relatively certain that it will be adapted and updated based on feedback we get from its use out by all of you and those you share it with. So thanks so much for all of your participation today, and look forward to hearing more from you about it. And thanks for being willing to use the question box as a chat box and have your anonymous comments spread to everybody. And for those of you who may be healthcare professionals, there are additional skills that can be easily built on top of the brain worksheet. For example, if you're the person who needs to describe statistics to somebody, some of those concepts that we use in clinical care, like numbers needed to treat or risk and benefit ratios, there are ways to explain those that are easier for everybody to understand, including the professionals. So that's an additional level of skill that people might be interested in getting at some point in time. And so happy to help you understand what the next step would be. So thanks for joining us. Feel free to sign off as you need to, and we'll answer any questions here that you might have. Thank you for sharing your stories in the chat. Appreciate it very much.